Hi, how are you? So before to begin, I want to also thank you, kind of the CMHA team for coaching us and letting us to start this project. So in the room, I'm Zahra, the harm reduction coordinator at Sistering, and Kimia, the consultant and research and evaluation expert, and Priyanka, our unit director, and Tekla, the other unit director of Sistering, may join us. So what we are presenting is the project that we call it Reducing Conflict Amongst Participants with Multiple Presenting Issues within a Low Barrier 24/7 Drop-In. And so what we're going to do is that we try to give a little bit of introduction about Sistering and what we learned through the E-QIP project and how was the process of our own project, which still we haven't finished. We are very new to this project, and we just started, I think, 6 months ago. So next slide, please. Yeah, so about Sistering. Sistering is a low barrier trauma-informed place for all women, and then so we are serving most marginalized women who are coming with a long history of homelessness, complex mental health issues, substance use, sex work, and overall all kinds of racialized population. And by women, we identify whoever identifies herself as woman, so including trans women and non-binary. Next slide, please. So as I mentioned before, we are a 24/7 drop-in, which means women can access to our services 24/7. They can come and go out. We don't have any formal intake process, so we don't ask questions. As long as women start talking to us, it's okay with us. So we provide 3 meals a day. We have resting area. We have laundry and showers available for women, and we distribute lots of donations that we receive from the community. The major programs that we have at Sistering is harm reduction program, case support workers, medical clinic and counseling. We have a spa studio. We have peer employment program. We do lots of social and recreational activities, and we do a lot of advocacy activities in the society. Next slide, please. So at Sistering, actually, what we have seen during the past year is that we have served over 3,200 participants, and most of them have used, actually, our drop-in, and they're also able and willing to participate in different surveys that we do with them. And we have a range of over 50 participants that can spend over the night with us. Unfortunately, we are not a shelter. We don't have beds or private space for women, but we really provide a space, a safe space for women. And on a daily basis, we serve more than 400 meals for women. Next slide, please. Okay, then I have, okay, I think we had, yeah. So about this project is that, so as you mentioned yourself, it's a partnership between AMHO and Health Quality Ontario and CMHA, and then we try to promote and support quality improvement in our community of mental health and addiction sector. So we have been through workshops on quality improvement process and tools. We received coaching from you, and then we learned about community of practice, and also we were able to learn about other participating organizations and learn from them. Next slide, please. So, and then now I hand over to Kimia, please.
Hi, can you hear me?
Yeah.
Okay, great. So yes, the reason that we wanted to be part of the E-QIP process was to look at one of the key challenges that Sistering is having as an organization, and that is the level of conflict or violence that's taking place between participants, particularly in the 24/7 drop-in. Next slide, please. So Yeah, so just going through the different steps of the E-QIP process. Part one was around preparing for quality improvement. Next slide. So first thing we did was really look at the problem and identify the problem. So just again to give some background, what we're seeing is a high frequency of participant-to-participant altercations at string, primarily taking place in the drop-ins. So there's different types of conflict and violence that have been observed and reported: physical violence, harassment, bullying, verbal aggression, and racism and discrimination. What we're seeing is that the high level of violence and conflict is affecting participants and staff alike, whether it's through increased feelings of trauma and just emotional distress, and the physical impact of physical violence and feeling unsafe in the space. So those are some of the things that we want to address, is creating a safer space for participants and staff alike. And yeah, and just as it's mentioned here, it's taking quite a bit of staff time and human resources to manage the high frequency of conflict taking place. And since Sistering did extend its hours to 24/7 back in 2015, there's increased. It's hard to say because we don't have the data from before 2015, but it seems that there's increased frequency of conflict occurring just by virtue of the fact that the drop-in is open 24/7. So one thing that we decided to do, and you can move to the next slide, to better understand the problem, the E-QIP coaches have suggested that we look a bit deeper into the data. We have violence incidents reports. So most of the incidents are documented primarily in the drop-in. So what we did was look at that data to have a better sense of what is happening, what the nature of the violence is, when is it occurring, where is it occurring. So next slide, I can just go through some of the key data that came out of that rapid analysis of the data. So one thing we did was document the nature of the violence occurring. And I should mention that in the violence incidence forms, there were, I guess, people reported differently on the violence. It was more in qualitative format. So what we did our best to categorize the qualitative data from the reports. And from that, we were seeing highest incidence was physical violence, so hitting, punching, kicking. And so we've decided that that's what we want to focus on for the E-QIP process, is looking at reducing physical violence in the organization. But here in this chart, you can also see other types of conflict and violence that have been experienced. Next slide. And in terms of time period of incidents, we're also seeing that there's the greatest frequency of incidents happening between 9 p.m. and midnight. So again, we've decided to look at that time period in specific, at least initially. We're going to focus our quality improvement processes within that time period. Next slide. And also we're seeing somewhat higher incidences taking place in the dining room within the drop-in between 9 p.m. and midnight. So again, we're going to focus on reducing incidences that are taking place in that particular location of the drop-in. So altogether, after doing the analysis of the data available on the violent incidences, our aim statement is to reduce physical violence in the dining room that takes place between 9 p.m. and midnight by December 31st, 2019. Zahra, I think it's back to you now.
So it's okay. Thank you, Kimia. So yeah, so based on the aim that we developed and then also considering the root causes of the violence. So to find the root cause of the violence, we try to use the diagnostic tools that we learned through the workshops, and that is including process map, fishbone, Pareto chart, and 5 whys. Can we go to the next slide, please? So yeah, so we developed process map. It's very high level chart of this process, but we try to understand what's in real situation happening when an violent incident happens, who is showing up, by time, how fast we are reacting, and what kind of resources we are using. Next slide, please. And then based on that, also we developed a fishbone. So, and we categorized it. We were able to categorize the root causes based on participants, physical space, policies, and staff. And then for each high category to kind of go deeper and see what other root causes could be. And we took this fishbone several times back to participants and staff to get their votes and see their opinions, which root causes is most important for them being causing the violent incidents at history. Next slide, please. And then after that, we tried to go through the 5 whys exercise to get deeper into root causes of conflict. And so we took the factors which got the greatest votes, either from the participants or the staff. And so we conducted different interviews with them, and then basically we tried to get 2 rounds of 5 whys. One, understanding the general problem statement, which is the overall violence incidents happening at Sistering, and the second was about our aim, which is reducing physical and after 9 p.m. and in the dining room. Next slide, please. So when we asked participant, as an example, why do you think more conflicts are happening after 9 p.m. in dining room? They would answer because women start attacking cleaners after 9 p.m. And why is it like that? Because they are resistant to moving their stuff. Why is it like that? Because they don't like their space being invaded. And why is it like that? Because there's lack of clarity on how to live in a shared space. And then why is it like that? Because there is no consistency among staff practicing or kind of dealing with different participants. Next slide, please. The same we did around tendency of circular arguments or lack of congruence, like we asked staff this time and the same question, and they responded because people have mental health issues and they are triggering others. So why is this happening? Because they are mad or yelling. Why is this happening? Because there's not enough space for everyone. The fact that they are living in a shared space. And why is that happening? Because staff are lacking empathy. And why is that happening? Because staff don't have the same and right training. Next slide, please.
Oh, can I just plug in there?
Sure, please.
Yeah, I just one of the reasons on this previous slide I added a little arrow there.
Yeah.
Was just because Zahra and I and Priyanka, we had discussed it, that there were some difficulties using this 5 why tool, because we often found that the conversation went in very different directions. So if you look at the 3rd why come to the 4th, it doesn't really feel like there's any like link there, and that happens quite often with the discussion. So it was a bit difficult to use that tool, I found.
Yeah, I just want to add also to that because Sistering Nature is really fast responding. So we are dealing with a huge number of participants being in the space at the same time, and then so it's very fast, and then you have to respond in the moment to the needs. And so at the same time, if you are engaging participants or staff in an interview, it's really hard to get their concentration and to focus what's really are the root causes. So that's why I think so we had so many back and forth. But yeah, we are trying to get the best responses. Okay, next slide. Yeah, and I think as a team, we came up with this 3 root causes of conflict, which is lack of clarity and consistency in our policies. We have, of course, limited space and lack of participant engagement and monitoring on the drop-in floor. So yeah, and then the next step is that working on these root causes. So Kimia, would you mind to explain the next slide, please? Yeah.
Yeah, great. So, so now the next part of the process was understanding the measurement plan. So you can move to the next slide. So what we're going to be using is a run chart looking at the number of violent cases per month, and basically compare back to our earlier data from 2018. Just a few things I flagged for our team to consider as we collect this data is looking at how we can build in more consistency across the reports and potentially adjust the reporting template so we can increase that consistency, and how it is that we define conflict, what kinds of conflict are staff reporting on versus not, and how do we again ensure that consistency in how it's being defined. And then also just providing the necessary staff training on how to report back on violent incidences for that increased consistency, and how we want to actually monitor this process. Because again, as a researcher, I'm just it's really important, I find, to make sure you have that integrity in the data itself. So yeah, and now part 4. So we're at the stage of developing and planning solutions. This is a work in progress. Next slide. So there's 5, I guess, key tools that we'll be looking at as part of this process. The first was the hierarchy of effectiveness chart. It was part of one of the E-QIP workshops and really got our team thinking. This next slide. Around, how to have work towards more moderate to high level effectiveness in our change ideas. I do think for the time being, we've decided that the low leverage ideas are where we'd like to focus as an organization, but with long-term vision in mind of considering some of those moderate level effective ideas that we can be implementing in the future. But yeah, we did find this chart very helpful and something that we'll be referring back to, I think, over time. Next slide. Yep, and so we're currently in the process of developing the driver diagram. It's just in draft right now. So within our team, Zahra and I have kind of put together our change ideas. We're then sharing that with Priyanka and other staff and with participants as well. So we're just at the stage of kind of determining what's the best process to move forward to consult with a range of staff and participants as part of this process. But this just gives you an idea. This is just one part of the driver diagram. I think it's a 3-part diagram. This page is looking more at how to address inconsistencies in safety procedures, safety processes. So these are some of our ideas around that. So we've divided it up into gaining clarity in the safety procedures, consistency in how they're implemented, and then participant education on the safety procedures. So we have various change ideas we're looking at, but again, this is just in draft form. It hasn't been shared with other staff yet. And after basically collecting various change ideas from across staff and participants, we want to look at shortlisting, essentially based on what would have highest impact, least effort. So using the impact grid that you shared with us in the workshops, and also looking at cost effectiveness of different ideas as well. So yeah, we're just in the beginning stages really of developing these change ideas. So I think that's it on our end. I noticed that the other team had kind of outlined their lessons learned and so on. I'm not sure if that was part of the expectation of today's presentation. If so, apologies. I think we missed that point and don't have any slides looking at our lessons learned. But Zahra, Priyanka, I think we can just maybe share some thoughts.
Yeah, I think my apologies again also if we missed that part, but maybe that happens because we still are in the middle of the whole process. Even not in the middle, I don't look at that in the middle. But I feel I personally learned a lot about how engaging participants and staff in the process is important to kind of revisit what we are doing and then overcome our own biases. And then the tools have helped myself personally a lot to organize my thoughts and my practice towards this specific project, and then also reaching out to staff and then seeing what other resources we lack. Yeah, that's my end. How about you, Kimia?
Yeah, I found the tools very helpful, and they kind of gave some structure to how we've approached this challenge within the organization, and also the coaching. I just want to thank all of you for your support. It's been really helpful along the way, and especially kind of encouraging us to take time and really understanding the nature of the problem, and just take time where we needed to take some more time and not feeling like we have to rush through the process, because I think there were times where we did feel that way, and then you encouraged us to take the time we needed to understand understand the data, understand the best way to move forward, and we really appreciated that.
Yeah, that's it. If there's any questions.
To invite folks to type in any questions that you might have into the chat box. We do have one question from Laura. Has some kind of environmental assessment occurred at your facility from an outside source, i.e. police? I'm wondering if there are safety risk recommendations that a third party could also provide you.
Oh, very tough questions, actually. So honestly, we don't have any recorded documents towards that question to answer. I just can talk about my own personal experience. So we have police officers inside for a lot of occasions that happens, but not necessary that I can recall that they have mentioned any specific things. We know already some of our practices could be improved regards the safety, but as I said, also the nature of system, which is a 24/7 drop-in, and we are low barrier, which means we don't have policies around how many luggages, for example, people can bring in. We don't have any searching. We don't kind of policing around participants when they are at our space. So yeah, but that's a really good question. We should consider that, kind of considering having their inputs also. Thank you for that.
I just wanted to offer a comment and a question as well. First of all, my comment is incredible work with the data. I was really, I had it muted here so you couldn't hear me, but I'm really admiring, I think our whole team was, the use of data to look at the types of incidents, the location of incidents, the time period that they were happening, to really drill down to identify what were the most prevalent and where might you want to take action. So, very, very good use of data. Has there been anything from this project that you really see yourselves using again in future in terms of any of the tools or the methodologies? Is there anything that's really stood out as being helpful to you in future projects?
Kimia, do you want to explain? First of all, I want to say kind of big kudos to Kimia. She's one of the best researchers I ever worked with, and then all this kind of difficult part of the project, which was related to data analysis and giving the clear picture of what's happening, goes back to Kimia's work. So I cannot take any credit of that. So Kimia, do you have any idea about one of the tools that was mostly useful for us?
Sure. Thank you, Zahra. I'm blushing. Yeah, I think for my end, there's a few tools. I really like the fishbone process and really trying to dig down into the root causes. I think it was a really effective activity, and beyond kind of going around and collecting votes using the fishbone, we also did we were doing a staff needs assessment survey anyhow, so we included a question about causes of violence, and were able to collect information that way too. But I think it was a really effective exercise for the team to kind of have to think about the root causes, and that might have been a new idea for a lot of people. And I think also for me, the driver diagram, I mean, I'm used to a lot of different types of models like that, but I did find that one useful. And also the kind of creating that, but in conjunction with the impact grid, I think is really key. So yeah, I liked a lot of the tools that were presented in the workshops. I found they were useful. And in terms of future use, because we're going through a needs assessment at Sistering, so we're learning these tools with you to look at violence in particular, but we have full intention of using them, using the quality improvement process to look at some of the other key challenges that have been identified through our needs assessment process. So yes, that was very much our vision, was to participate in this process to then use the tools towards our overall needs assessment. So yes.
Thank you very much, Zahra and Kimia, for sharing this work. A fantastic project and a great example, I think, of the use of the tools and really doing a very thoughtful project. So thank you very much for sharing with us today.
Thank you.
So next on the docket is Laura Liebrock.